Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hello everyone and welcome to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Marie Stella, coming to your ears from Naarm, Melbourne, Australia. Let's learn together.
Hello everyone and welcome back to the show. Today we are diving into the topic of supplementation and importantly the language behind it. Supplements have regulations and so much terminology that it can sometimes be difficult to decode what's written on the packaging. So today we have Professor Cathi Dennehy joining us to explain the complicated language of supplements. Cathi is a clinical professor in the University of California, San Francisco School of Pharmacy. She served as director of the postgraduate Year 1 residency training program at UCSF for 16 years from 2001 to 2017, graduating and mentoring approximately 200 pharmacists. In the School of Pharmacy, she directs coursework in gastrointestinal therapeutics. She also serves as chair for core content in interprofessional skills. The interprofessional skills content is delivered to around 600 students annually across 5 health professional schools. Cathi is internationally known for her expertise in herbs and dietary supplements based on her publications, clinical research, affiliations, speaking engagements, and health education. She provides regular direct patient care in 2 clinic settings, the anticoagulation clinic, where she assists patients with medications to prevent blood clots, and in a transitions of care clinic, where she manages medication questions and medication access issues for patients immediately following hospital discharge. So, with this wealth of knowledge and amazing experience, I'm really excited to interview Cathi today and learn from her. So, welcome to the show, Cathi. It's really great to have you here.
Thank you. It's a pleasure to be here.
It's a pleasure to have you and to be interviewing you today. So just to get started, I wanted to learn a bit about your background. So can you tell me what drew you to a career in supplements and herbal medicine?
Well, I started my work in this area back in around 1997, shortly after the passage of the Dietary Supplement Health and Education Act, which is a key piece of legislation governing how dietary supplements are regulated. The supplement market in the 90s was booming, still is booming. And this was an area that healthcare providers knew little about. So it was an excellent opportunity to specialize in an area and be a source of evidence-based information. I'll also say that pharmacy has its roots in plant-based medicine, with some of the first pharmacopoeias being entirely plant-based. Today, about 50% of our drugs come from natural resources, of which 25% are plants.
Wow, that is really fascinating. So, sort of to introduce our topic, I guess, what is a common misconception about supplements?
Well, supplements, at least in the United States, are available to consumers over the counter in the same way that over-the-counter medications are available, except that they're regulated very differently. Over-the-counter medicines like Tylenol are required to show proof of efficacy for their intended use, and they're also required to show proof of safety before being marketed to consumers. Dietary supplements can be marketed to a consumer, and they don't have to tell the FDA what the indication is for that product until 30 days after the product is marketed. And they don't have to submit any efficacy data for the use either. And they don't have to show proof of safety. They can only be pulled from the market if they're proven to be unsafe. So those are I think that's a big misconception, is that they're the same as other over-the-counter medications for self-care, and they're really not.
Interesting. So it's kind of like innocent until proven guilty with the supplements, whereas medicine is like, no, we have to be like completely right the first time.
Exactly.
Interesting. So before we go any further, we want to get to know you a little bit better. So this is Have You Met Cathi? I'm going to ask some sort of quick fire icebreaker questions. So if you can just answer in a few words, that would be amazing. And the first one is if you have a favorite hobby.
I do. I really enjoy cooking. I grew up watching cooking shows with Julia Child, and I still watch cooking shows with chefs like Lydia Bustianich and Jamie Oliver. I also love reading recipes, and I'm, you know, really partial to the magazine Bon Appetit because it has a lot of good recipes in it.
Interesting. And what about a favorite movie?
One of my favorites is an older movie. It's a 1940 romantic comedy with Jimmy Stewart. It's called The Shop Around the Corner, and it's set at Christmas time. It's all in black and white. It's in Budapest, Hungary. And the movie was the basis for the more current film known as Who's Got Mail. But it's a really great film. If you've never seen it, you should see it.
That sounds great. I love something set in the Christmas time. It's always just so beautiful. And do you have a favorite podcast? Do you listen to podcasts?
I listen to some. I don't listen to a lot. I actually like the podcast called Smartless. It has Jason Bateman and Will Arnett and Sean Hayes. It's super funny. It's got great comedy and interesting topics.
Perfect. And do you have a role model? This could either be like a personal or a professional role model.
My role models, I think for a lot of people, also for myself, have always really been my parents. My dad was a really hard worker. I kind of aspired to be like him and able to support myself and also to be a great mom. My mom was very engaging and always very supportive.
Excellent. And is there a class or course that's inspired you? This could be something that you've taken or something that you teach.
Yeah, I'm going to actually say it's my gastrointestinal therapeutics course. I have about 120 students in my class each year, and I've been teaching for about 30 years now. I really feel like the impact that I can have on each of these learners is tremendous, and I care that they know how to advise a patient on medication use. If each of my students, just to give you an idea, if each of my students in my class went on to provide healthcare information to 500 consumers or patients in a year, that's almost 2 million people that are impacted by the quality of the education in my course. And I think that's pretty inspiring.
That is extremely inspiring. And my last question for you, is there an important lesson that you've taken from one or more of these things that we've just mentioned?
I would just say that the most important lesson that I have is value your time and how you spend it. To me, life is precious. Life is about laughter and human connectedness, great food, travel, and doing something in your career that positively impacts your footprint in the world. And so that's really how I feel.
That's amazing. Well, we're now going to dive into our topic and learn a bit more about dietary supplements.
Great.
So, first of all, let's get some basics down. What does longevity mean to you?
To me, it means living in good health. And the reason that I say that is every day when I'm working, and I do work in a transitions of care clinic where I see patients being discharged from the hospital with a variety of health conditions, some very serious, as much as you can, just to be able to eat healthy foods, get a good night's sleep, exercise, try to maintain your ideal body weight, and observe preventative care, dental care, eye care, colonoscopies, breast cancer screening, things like that. I think that is really what longevity is meant to be, taking care of yourself over time to give you the best quality of life.
Absolutely. And so, on our topic for today, what are dietary supplements?
They are officially products that are meant to supplement the diet. They're meant to be taken orally. They are regulated as food products. And dietary supplements can be marketed for many supportive health reasons, spanning from mood to energy to healthy bones, supporting a healthy heart. So there's many different indications that they're marketed for. But overall, they are really intended to support your normal, healthy living, if you will.
Yeah, absolutely. And how might supplements contribute to overall health as we age?
This honestly, to me, depends on your diet. If your diet lacks nutrient-rich foods, then supplementing with a multivitamin could make sense. You might supplement with fish oil if you're a person that doesn't eat fish or who has a low omega-3 fatty acid intake in your diet. I see supplements as a means to enrich your diet. There are also a host of other supplements that are marketed that have nothing to do with diet, things like glucosamine, melatonin, CoQ10, ginkgo biloba, turmeric. For these types of supplements, it's important to look at evidence-based medicine to see whether the product has shown some evidence of efficacy for the intended use, and check safety as well to see if it's a good choice for your health history and with the other medications you take. I want to mention here, there is research that is cutting edge that was recently published. It was published in May of 2025 in the American Journal of Clinical Nutrition. They were looking at supplementation with vitamin D3 and with omega-3 fatty acids, and they were looking for an effect on telomere length. Telomeres are protective, and they're found at the end of chromosomes. What they found is that if you protect the telomeres from shortening, you can prevent irregular cellular division, and that may be beneficial for cellular aging. So what this trial found is that supplementation is called the VITAL trial for people who'd like to look it up, VITAL, is that participants who receive supplementation with at least 2,000 international units a day of vitamin D3 with or without omega-3 fatty acids had significantly less telomere shortening both at 2 years and at 4 years. So this suggests that vitamin D3 may have a role in counteracting the shortening of telomeres, which could be helpful for cellular aging.
That is really, really interesting. I love hearing about new research in the field. And, when our guests come on the podcast and talk about something really new and innovative, it's really exciting to hear that there are new developments. So I now want to dive more deeply into the language. This has been an amazing introduction to sort of what dietary supplements are. There is a lot of terminology that I had no idea about before taking on this episode. And I think it's important to try and break it down before we go too much further, because some people will need to understand it if they're looking into taking a dietary supplement. So firstly, can you explain dosing and why people might think it's related to weight?
Well, for certain medications, dosing is based on weight. So it is for someone, let's say, for someone who's of normal body weight, the ratio of lean weight to adipose or fatty tissue is about 4-1. In a person who's overweight or a person with obesity, the lean weight to fatty weight ratio is about 3-2. And fatty tissue has little metabolic activity. And the ability of a person to remove a drug from the body is based on that metabolic activity and lean body mass. And so for this reason, certain drugs have to be more carefully monitored for efficacy and side effects when a person has more body fat present. Pediatrics is another area where dosing is routinely based on the body weight of the child or the teenager. Teenagers less so if they're older. But in general, dietary supplements have not been studied for weight-based dosing. So it's less important, I would say, for dietary supplements as compared to medications.
Interesting. And what is standardization? This is something that maybe people have heard of in terms of dietary supplements, but I believe not all supplements have standardization. So what should we look out for?
Yeah, that's exactly right. So standardization occurs in certain plant-based supplements when a chemical marker or a compound in the plant has been identified as being important to the overall clinical effectiveness. Plants can have many chemical ingredients, and the ingredients are different based on the plant genus, the plant species, and also the plant part. Some examples of standardizations that you may have heard of are ginkgo biloba, which is often standardized to have 24% flavone glycosides and 6% terpene lactones. There's St. John's wort, which can be standardized to 5% hyperforin, and saw palmetto, which is often standardized to 85 to 95% fatty acids and sterols. if we don't know what the lead chemical compound is in the plant that's contributing to the overall effect, then the supplement's not going to have standardization. And in general, you see standardization on plant-based products only because plants have many ingredients. So you're not going to see standardization on something like melatonin or glucosamine or CoQ10. And the reason why is because those products are already 100% of that chemical structure. They're 100% glucosamine already. So there's nothing to standardize to.
Interesting. Well, this actually leads me perfectly to the next question, which is, if you're looking at a label, how can you know what is plant-based and what's not?
Yeah, so you can tell what's plant-based because you're going to see a genus and a species on the label for the plant. And so some plants, like let's take, for example, echinacea. Echinacea, there's actually 3 different types of echinacea. There's Echinacea purpurea, which is the one that's been studied the most. There's Echinacea pallida, which has been studied less so, and there's Echinacea angustifolia. So as a consumer, you should be looking for a genus and a species. And if the manufacturer is following dietary supplement labeling law, you're also going to see the plant part listed. Like it'll say the roots of or the above ground parts of. And that's important because when you look at the efficacy of a product for a particular use, the studies that have been done are using very specific formulations, oftentimes standardized formulations, and they're using specific plant species, and they're usually using a specific plant part. So it's important to look for those things if you're knowledgeable, like if you know that the above ground parts of the Echinacea purpurea plant are that's the species and the plant part that's been studied the most, then that's what you want to look for when you're going out and shopping for an Echinacea product.
Yeah, that's really interesting. I had no idea about, I don't know very much about supplements. So what's actually written on the label is quite interesting to me to find out, what's what and what it might actually tell you. My next question for you in terms of terminology is, can you explain the tolerable upper limit?
Sure. So tolerable upper limit is something that is, it's been set usually for vitamins, not as much for minerals. It's the maximum amount of the nutrient from all sources unlikely to pose a risk of adverse health effects to humans. And these are published. You can go to the NIH website and National Library of Medicine, and you can see that for something like vitamin D, the upper limit for someone whose ages 1 to older, an older adult, is about 2,000 international units a day. For something like vitamin C, the upper limit for persons ages 19 and older is 2,000 milligrams a day. So the reason this becomes important for consumers, if you're someone who takes a lot of different types of dietary supplements, and maybe you take something for prostate health, and maybe you take a multivitamin, and maybe you take something for brain health support. And if you flip those bottles over and you look at those labels, you may see some redundancy in the vitamins that are in those products. And so if you have vitamin E in this product and vitamin E in that product and vitamin E in this product over here, you're going to want to check the upper tolerable limit for that nutrient to make sure you're not going over that so that you're not at risk for adverse health risks.
Yeah, that's a great point to make. If people are taking multiple supplements, that you should really check. Some of them have, multiple vitamins or multiple things in them, and you just might not know because you think you're only taking, the main ingredient, or you only think you're taking, what it's advertised for, but something else that you're taking that's advertised for something else might have some crossover in the ingredients. So important to note. So thank you for bringing that up.
Of course.
My next question for you, what is a proprietary blend?
We get this question a lot. So this is where I like to think of it as a recipe that is specific to a particular manufacturer. So if I had, a product that I was trying to market, but I didn't want anyone else to be able to manufacture that same product with the same ingredients in the same amounts. I would have to keep my formula or recipe, if you will, a secret. I would tell you that the product has these 5 ingredients in it, but I'm not going to tell you how much of ingredient A or B or C or D or E are in the product. I'm just going to tell you that if you take 1 capsule or if you take 1 tablet, which in this case, let's assume that's the serving size for the product, that my proprietary blend of 5 ingredients will give you 1,000 milligrams of compounds A to E, but you don't know how much of each one is in there. So that's why it can be a little bit confusing. As a pharmacist, we like to base our recommendations on giving someone an appropriate dose based on the condition that they have. So when we can't tell what dose of ingredient A, B, C, D, or E is in the product, it can create some confusion, if you will, about just how effective that product's going to be. So I like to think of it as a secret recipe. I will say this, under dietary supplement labeling law, if you're a consumer that uses a proprietary blend, it is a requirement of the manufacturer that they list the very first ingredient is the one that's prevalent in the highest amount, and the last ingredient is the one that's present in the least amount. So that is a requirement based on manufacturing law if you have a proprietary blend.
That's really interesting. It's a bit tricky, isn't it? You're taking something and you don't really know how much of everything is in it. It makes me feel a little bit like, oh, I don't know about that. But, of course, you take the advice of your pharmacist, like you know best of what's going to work for different people. So it's interesting.
Yeah, I'll say based on what you just said, Sarah, that it's really the manufacturer of the supplement that it's their responsibility to make sure that if you're using the product as directed, meaning you'd flip a dietary supplement over, you're going to see something called a supplement facts panel, which gives you the information on what the dose is, what the ingredients in it are, and how to use the product. So if you're following the dietary supplement label that's on the back in terms of the recommended use based on the manufacturer of the product, the manufacturer is responsible for ensuring that it's safe for use when used as directed based on dietary supplement labeling laws.
Yeah, absolutely. Very interesting. So what does daily value or percent of daily value mean?
So this really helps consumers determine the level of a nutrient in a standard serving of food in relation to their approximate requirement for it. So most daily values are based on the RDA, which is the recommended dietary allowance or the nutrient intake sufficient to meet the needs of 98% of healthy people. So it's really, if you look at daily value, it's something where you can, when you have various food products that you're buying, let's say you have 2 loaves of bread in your hand and you're kind of looking, well, this one slice gives me 20% of the daily value of fiber, but this one over here, one slice only gives me 5% of the daily value of fiber. Well, we know that women need about 25 grams of fiber a day and men need about 35 grams of fiber a day. So which one are you going to pick? If you're looking for something that's higher in fiber, you're going to use those daily values and you're going to pick the one that has a higher fiber content.
Interesting. I like that you're relating it to food because it's a lot easier to picture sort of what that's like because we do that on a daily basis. So my next terminology that I want to learn about is claims. What are the main types of claims that can appear on the labels and what do they mean?
So under the Dietary Supplement Health and Education Act, there's 3 types of claims that can appear on supplements. The first one we typically see not so much on supplements. We often see it more on food products, but it's a health claim. And a health claim is FDA approved because it links the intake of a food component, or a dietary ingredient to reducing the risk of a disease or a health-related condition. So an example of this might be a diet rich in calcium and vitamin D may decrease the risk of osteoporosis, or a diet low in saturated fat may reduce the risk of coronary heart disease. Or another example would be a diet rich in folate may reduce the risk of neural tube defects. So that's one type of claim that is FDA approved. Another type of claim is what we call a nutrient content claim. This is also FDA approved. It characterizes the level of a nutrient in a product for comparison to another nutrient source. An example would have been that bread example that I just gave to you. And you can say that something on the actual packaging of that food product. You can say this is an excellent source of, or this is high in, or this is a rich source of, an ingredient, let's say calcium. If a single serving of that product has at least 20% or more of the daily value of that ingredient. A good source would be having 10 to 19% of the daily value for that nutrient. Sometimes you see nutrient content claims on vitamins. They can say they're high potency if at least 2/3 of the vitamins and minerals in the product are present with 100% or more of the daily value. Now, the type of claim we see most often is what we call a structure function claim. This links a food component, or a dietary supplement ingredient to maintaining normal, healthy structures or bodily functions. So an example here would be something like glucosamine supports healthy joint function and cartilage, or bromelain from pineapple extract helps support healthy digestion and digestive wellness. And another example might be turmeric provides antioxidant support, joint support, and supports a healthy inflammatory response. So those are examples of the three types of claims. The structure function claims are not FDA approved. And if you recall at the start of the program, I mentioned that a manufacturer who's marketing a dietary supplement does not have to inform the FDA of their structure function claim until 30 days after it's been marketed to a consumer.
Very interesting. And, that's sort of the one that you see the most often in advertising as well, right? Like, this product supports healthy joints or whatever it happens to be.
Absolutely.
Very interesting. So speaking of, the FDA and all that kind of thing, I'd now like to move on to speaking about regulation. Now, this is a topic that I think is probably most heavily discussed when it comes to supplements because people don't quite know how they're regulated. And that also means there's probably a lot of misinformation floating around. So let's see if we can dispel some of that today. So obviously, I've heard the misconception that supplements are not properly regulated. So how are they regulated, and are there any that we need to be cautious about?
Well, they're regulated, as I mentioned, under the Dietary Supplement Health and Education Act, which is a piece of legislation that was passed back in 1994. Because of the Dietary Supplement Health and Education Act, a dietary supplement manufacturer, as I already mentioned, doesn't have to share their structure function claim with the FDA until 30 days after the product is marketed. They also don't have to show proof of efficacy or safety for the product at the time of marketing. It's assumed to be safe based on the manufacturer's directions for use. And the FDA can only pull a product from market if it is proven to be unsafe under the Dietary Supplement Health and Education Act. So because of this, there are things that happen that are concerning. And there's certain products that we do need to be careful with. Adulteration can occur with supplements. That means that the manufacturer has added an ingredient not listed on the label that could be harmful, could be a drug, could be a heavy metal, could be plant substitution with a plant that's less costly. An example would be a product marketed for blood sugar support that contains a prescription drug like glyburide, or a drug that's been pulled from the market like fenformin. Fenformin is a drug that was marketed at one point for diabetes, but got pulled from the market for very serious side effects, something called lactic acidosis. The FDA does call out, based on the number of recalls it does, supplement categories that are more likely to have adulteration. And two big categories of products that are more likely to have adulteration are supplements that are marketed for erectile dysfunction. They frequently have a product in them called sildenafil, which is basically the same drug as Viagra, and weight loss products. Weight loss products have been found often to have an undeclared drug in them called sibutramine. And sibutramine was a drug that was marketed to treat obesity, but was withdrawn from the market due to increased risk of stroke and cardiovascular disease. And so supplement manufacturers, they want to sell the product, but they may do it in a way where they're adding things that can be harmful, or that, the ingredients aren't accurately listed on the label. The other thing that people need to look out for is when a supplement manufacturer is marketing something where a disease state is implied. So during the coronavirus outbreak, we saw a lot of supplements being marketed that suggested that they might be helpful in supporting someone's immune system to prevent them from getting coronavirus at the time. And so there was a lot of recalls happening during that time with supplements that were linking themselves to a preventative health effect for coronavirus.
Yeah, that's really interesting to hear about, how the context can change how the supplements are made and advertised, in the world. Interesting. So, why must supplement labels include disclaimers about FDA evaluation? And what does this mean for consumers?
Yeah, so if a product has a structure function claim, it is required by law that it has a statement that says, this product has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. And this is really to make consumers aware that supplements are not disease treatments. They're not meant to, help you with an acute or a chronic illness in the same way that medications are. They lack the efficacy and safety data for use as a disease treatment. And so this is the FDA's way of sharing that information with consumers.
And since the initial regulation was passed in 1994, have there been any new changes in regulations that have been impactful?
Yes, so there's actually a few. There's two that I can think of. There's one, they were both passed in 2007. There's one that's called GMP, which means Good Manufacturing Practice Requirement. And this means that manufacturers were required to ensure that their products were pure, free of contaminants, and contain the type and the amount of ingredients listed on the label. So that was a step in the right direction for manufacturing of the products, because we were seeing products that would be marketed where, it would say an ingredient on the label. So you thought you were buying, St. John's wort standardized to 5% hyperforin. But then when they looked at product analysis, some products had no St. John's wort. Some products had, much higher levels of hyperforin or no hyperforin. So this was an effort to kind of remedy that. The other piece of legislation that was passed was called the Dietary Supplement and Non-Prescription Consumer Protection Act. And this was really, really key because it required supplement manufacturers to report, it was mandatory reporting to the FDA of serious adverse effects, things like death, life-threatening experience, hospital admission, birth defects, medical or surgical interventions being required. So now manufacturers must report that to the FDA. The other thing that it did is it required record keeping by manufacturers for all consumer complaints over the last 6 years and how those complaints were handled. So it really is beneficial for the FDA. So if something starts to crop up in and around a particular product's use, they can go to the manufacturer and say, we're starting to see several concerning reports of liver toxicity with this particular product. Can you show us your 6 years of data? Or can you share with us how those adverse effects that got reported were handled? And so that just gives the FDA more, if you will, support in knowing when something has to be pulled from the market.
So far we've discussed the language in depth, and I've learnt so much from you already, even though we're only, half an hour in. So I'd now like to talk about the application. How can we apply this knowledge, and how are people making decisions regarding supplements? So first of all, in terms of all this language that we've discovered and all these terms that we've defined, how does the language of dietary supplements help or hinder consumers in making informed choices?
Yeah, I mean, there can be misleading or confusing language that you find. I will say that, the structure function claim itself can be confusing for consumers. When a product is telling me that it supports my well being, or it supports my brain metabolism, or supports my healthy aging, what does that really mean? Um, we need to steer clear of products that have language that is kind of uh, exorbitant, like this has a miraculous ingredient, or this has secret ingredients and no one else has this ingredient. It's secret to our company, but if you buy it, you'll have it. You need to be careful if a product is claiming no side effects. You need to be careful if the product is saying that it's FDA approved, because supplements are not FDA approved. And you have to look out for things like pseudo medical jargon. So, this is something where a supplement might say that it zaps your blood sugar to normal in just a few days. So, this is not, it wouldn't happen with a medication. It's not going to happen with a dietary supplement. And zapping one's blood sugar is not something that's medically sound anyway. It doesn't make any clinical sense. So I think, there is a lot of misleading or confusing language that can crop up around the use of dietary supplements, um, and so it's important for consumers to know where to look for accurate information.
Yeah, well, that's exactly what I want to ask you next. Where can we look for the most accurate information on supplements so that we can make more informed and less confused decisions?
Yeah, so there are government websites. There's the NIH, the National Center for Complementary and Integrative Health. That website is nccih.nih.gov. It's great because it has evidence based monographs. So you can find monographs on plant based supplements and also on products that aren't plant based, like melatonin and glucosamine and, you know, um, CoQ10 and things like that. It also has information on clinical trials that are happening with dietary supplements. So that can be very interesting to look at. The other website I'm going to suggest is something called the US Food and Drug Administration. So it's actually the FDA.gov/food website. If you go to that, FDA.gov/food, and you type in the word dietary supplement, you will get a lot of information about significant legislation surrounding dietary supplements. You'll see press releases for products that are involved in supplement recalls, where the manufacturer has received a warning letter and not necessarily corrected the problem. And so now the FDA is recalling the product from being marketed to consumers. And then there's one more resource I'm going to mention. It's called consumerlab.com. This one is a company that does require a subscription, but it also has very evidence-based supplement monographs and informational newsletters pertaining to supplements. They also do product analysis for quality that I'm going to talk about later in the program today.
Yeah, for sure. So I will make sure that all of those links are put in our show notes so that our listeners can go and find them easily if you are interested in having a look. So my next question for you, before we do get to the quality, is how can we tell if a supplement is safe? What do the cautionary statements on labels really tell us?
Well, it's difficult to tell if a supplement is safe. I'm going to say that it's wise to purchase your product from a large nutraceutical manufacturer and to stick to products that are not proprietary blends, where we don't know how much of the ingredients are in the product, and the actual weight or dose that you're taking. So single ingredient products allow you to tailor your supplement use to the type of support you're seeking. Now, you should look for cautionary statements on the supplement label, and cautionary statements like talk to your doctor before using this product if you're using a blood thinner is something to look out for. There are certain supplements, the 4Gs, which are easy to remember if you remember that they're all Gs. So garlic, ginkgo, ginseng, ginger, and then we have a vitamin E. All of these have antiplatelet effects that could enhance bleeding risk if you're taking it with a blood thinning medication like warfarin or apixaban. And so some manufacturers will put a cautionary statement on there about, if you take one of these medications, check with your doctor first. But the Dietary Supplement Health and Education Act does not require manufacturers to list cautionary statements. So the lack of such statements does not imply safe use. So check with your healthcare provider, have them conduct a supplement drug interaction check, and that way you can kind of check to make sure it's okay with the medications you are taking.
That's interesting. So just because it doesn't have a cautionary statement doesn't mean that it's completely safe. So
Exactly.
you do have to be careful. Well, my last question in this section for you is, what are quality insurance programs, and how do we know if the supplement we're taking or looking to buy has undergone this type of testing?
Yeah, so they're quality assurance, not quality insurance. So it's quality assurance programs. So what these are there's 3 different quality assurance programs. There's one called NSF, which actually stands for National Sanitation Foundation. CL, which is Consumer Lab, which I mentioned previously under informational resources. And there's one that's USP, which is United States Pharmacopoeia. Now, all of these agencies do the same type of analysis, essentially, where they're looking at a product to make sure that it's the ingredients that it has on the label or what's in the product, that it's pure and free of contaminants, that the strength or the amount of the ingredients that are listed on the label are what's actually in the bottle, and that it's also bioavailable to the body after you take it orally. So if a supplement has had quality assurance testing on the label of the supplement, you're going to see one of these types of lettering. You're going to see an NSF symbol, or you'll see a CL symbol, or you're going to see a USP symbol. So it's a good idea if you're someone who's using supplements and you're interested in quality assurance testing, look for products that have those types of designations on the label, and that may help you pick a more reliable product.
Interesting. That's great to know about. So I've learned so much already in this episode, and I think this has been super, super helpful to learn about all of this terminology that might be confusing or that we might not have heard about before. I now want to move to our break segment, which is questions from the internet. I have a couple of questions that people have asked, and hopefully you can give some advice. So the first question that somebody online is asking is, can taking supplements interact or interfere with other medications?
So they definitely can. This is why it's important for consumers to ask a healthcare provider, like a pharmacist, to screen for these using a drug information database. These drug information databases are readily available in the community practice setting. Supplements can have additive effects. So as I mentioned, the 4Gs, if you take ginkgo or ginseng along with warfarin or apixaban, you're going to have an additive effect and increase bleeding risk, essentially, because those herbs, ginkgo, garlic, ginseng, ginger, they have antiplatelet effects that can be additive with that medication. Supplements can have opposing effects. So something like echinacea for immune support. If you have a person who's taking immunosuppressants, let's say they just had a lung transplant or a heart transplant or a kidney or a liver transplant, and they're on immunosuppressives, and then you take a supplement like echinacea, which can, have potential effect on improving or enhancing your immune support, that's counterintuitive to suppressing the immune system so that you don't reject the organ that was just transplanted. Another important one here is antioxidant vitamins. They can oppose the efficacy of certain chemotherapy medications that are used to treat cancer. So if you take vitamins, it's really important, and you're undergoing cancer treatment, it's important to share that with your doctor and have them screen for that to make sure that it's okay for you to use those vitamins while you're undergoing chemotherapy. Because some chemotherapy, it relies on oxidation to be effective against the cancer cells. The final example I'm going to give here is one of an interaction involving metabolism. So there is an herb called St. John's wort. It's widely known to increase the metabolism of a variety of medications, including things like birth control pills, transplant medications, medications for HIV treatment, and medications for the heart. So, in general, St. John's wort should be avoided in patients taking medications for chronic disease state management for this reason.
That's really interesting. Okay. And my next question online is, my teenage daughter drinks milk occasionally, but not every day. Does she need to take supplements to get enough calcium?
Your teenage daughter sounds a lot like my two children, my two sons. Not if she's getting enough calcium-rich foods like yogurt, cheese, tofu, collard greens, white beans, figs. Those have a lot of calcium in them. And you can also have fortified foods like cereal or orange juice that can be fortified with calcium. Depending on the type of milk she doesn't like, if it's cow's milk, you could also try something like soy milk or oat milk or almond milk. It is important to get sufficient calcium, though, which is based on your gender, and it's also based on your age. For a teenage cisgender female, that amount would be about 1,300 milligrams of elemental calcium per day. The reason it's important is because if you're not getting enough calcium to build bone in the developing years, your body is going to break down your existing bone to extract the calcium from it. Your bone is the largest storage of calcium in our bodies, and the body needs calcium every day for normal metabolism and optimal functioning. So if you're not getting enough dietary calcium, your body's still going to get it. It's going to break down your bone to get it, and that's not something we want. The last thing I'm going to say here is the type of calcium that's used can be really important. Calcium carbonate is very popular. It's called Tums. Calcium carbonate needs an acid environment for optimal absorption, so it's best if you take it with food. But if you're someone who takes an acid-relieving medication like omeprazole or pantoprazole or lansoprazole or famotidine, which is Pepcid, then you really shouldn't be using calcium carbonate because it's not going to work very well. Instead, you should use calcium citrate, which is not dependent on having an acid environment for absorption. But you do need to ensure that you separate all doses of calcium at least 2 times a day or 3 times a day, because your body can really only absorb about 500 milligrams of elemental calcium per dose. And if your daughter needs 1,300 milligrams a day, and if she's not getting it from food, she's going to need to take a calcium product at least 2 to 3 times a day to get enough calcium.
Yeah, interesting. That is fantastic advice. And I also loved what you said in the other question about asking your healthcare provider to screen for the supplement, because you can always ask just to check, right? If something's
Absolutely.
going to interact with your medication, it's better to know for sure. So I'd like to now move to our practices and habits segment. This is where I just want to ask you, is there a habit that you'd recommend people practicing if they're considering starting a dietary supplement or looking into them?
I would say looking for evidence-based medicine or asking a local healthcare provider to check an evidence-based source before you buy. It's important to know, why am I going to be taking this supplement? What am I hoping to attain from it? And is there actually any evidence to support the reason why I'd like to take it? Has it shown a benefit for that? And if it has shown a benefit, what was the formulation that was used? What was the dose that was used? And for how long? So an example here might be, many patients like to take glucosamine for their joints. And consumers may not know that there's 3 forms of glucosamine. There's glucosamine sulfate, N-acetylglucosamine, and glucosamine hydrochloride. But the most widely studied of these is glucosamine sulfate. And it is considered likely safe when used at doses of about 1 gram to 1.5 grams a day for up to 3 years. Now, the primary type of joint health that it's been shown to be beneficial for is osteoarthritis of the knee. So if you're someone who has other forms of arthritis, it may not offer a benefit. And research tells us that glucosamine sulfate has shown benefits in improving pain, function, and narrowing and improving joint space narrowing when used for up to 3 years when compared to placebo, but only in persons with knee osteoarthritis. So what I'm trying to get at here is know the indication for use, know the formulation that's been studied, know the dose that's been studied, and for how long. Most supplements, honestly, haven't been studied for 3 years or 5 years. Most of them have shorter durations of study because they're really not meant to be used for that long of a period of time.
Interesting. Okay. And what do you think are the challenges that people might face when they're trying to look into dietary supplements?
Well, I guess, the biggest challenge, I think, is where to get information. And I've shared some of these resources with you today to kind of help you with that.
Yeah.
But when it comes to looking for information, there's actually a study that shows that it's an older study, but it showed that when people are looking for information on dietary supplements, they're not asking their healthcare provider. Like doctors and pharmacists are way down on the list. The number one source was things like magazines and like social media and things like that, or asking a friend. So your source of information is important because, if you're seeing it in a magazine, it's likely to be someone who's a manufacturer who's trying to sell or market a product. So the information may not be as factual or as evidence-based as if you were to actually look on one of those government websites and do a little bit more research. So I think it's important to do that. And the reason it's also important to check with a healthcare provider is because, for certain healthcare providers like myself, I use a database called Natural Medicines. So this is one of the largest scientific databases that's out there on things like natural products and supplements. And I get a lot of questions from doctors, from nurses, asking me, my patient's taking this. Here's their medical history. Is it okay for them to take these 5 supplements? And then I write a lengthy reply to that. But I use Natural Medicines as a resource for that. And so healthcare providers, because they're affiliated with health institutions, they may have access to other data sets or databases like Natural Medicines, which is a subscription-based resource, and it's available to health professionals like myself who work at large medical centers. And it may be accessible also at some community chain pharmacies. I'm not quite sure, but it might be.
And I'm really glad that you've shared those resources, those links that I will pop in the show notes so that people can get the most accurate information, because it can be very confusing. So thank you so much for sharing.
Of course.
I'd now like to move on to the open mic segment. Now, this is your chance to talk about anything you're passionate about. I mean, I can see that you're very passionate about this topic, so feel free to continue on, but it doesn't have to be related to our discussion so far if you don't want. So the floor is yours.
Sure. I'm going to stay in the field of pharmacy for my open mic segment. I'm going to give some advice about maybe a supplement and maybe some over-the-counter medication tips. I want to talk about fish oil because many consumers use fish oil, but many consumers don't understand how to dose it. And that the dosing of fish oil is actually based on the omega-3 fatty acids in the product, and it's not based on the weight of the fish oil itself. So this is something we teach health professionals, and they're like, oh, I didn't know that. Or we teach consumers, and they go, I had no idea I was dosing this incorrectly. So consumers need to look at the supplement facts panel. Again, you got to flip that bottle over. The supplement facts panel is on the back, and it should tell you how many milligrams of the omega-3 fatty acids are in the product. So the omega-3 fatty acids are the EPA and the DHA. And by adding the milligram amount of each of these two ingredients together, and then dividing by the serving size, if it's more than one tablet, you'll know exactly how many milligrams of omega-3 fatty acids you're getting in each tablet. And then you can determine how many tablets you need to take to get to, let's say, 1,000 milligrams of omega-3 fatty acids per day. And 1,000 milligrams of omega-3 fatty acids a day is and was a common dose that was used in the VITAL trial that I mentioned earlier. It's a clinical trial, and for the omega-3 fatty acid arm, they found a significant reduction in heart attacks, in the need for something called percutaneous coronary intervention. So that'd be something like perhaps angioplasty. And they also saw a significant reduction in recurrent, but not first time hospitalization for heart failure. So there are some benefits with omega-3 fatty acids, and it is important to have a sufficient amount of omega-3 fatty acids in your diet. The next thing that I'm going to talk about is an over-the-counter laxative. Because I know a lot of people, I see this a lot in transitions of care where I help patients and they go home and they've just been discharged from the hospital and they have had surgery. And a lot of the times they're prescribed narcotic pain relievers, things like oxycodone or hydrocodone. And with these types of products, you can get constipation as a side effect because the narcotic is actually slowing down the ability of the intestinal tract to move your stool or poop along the intestinal tract. And so when you're prescribed an opiate medication like oxycodone or hydrocodone, you should also be prescribed a laxative. And the most common laxative that we see are things like Senna, which is beneficial because it helps to stimulate intestinal contraction to move the stool along. And then there's another product that's called polyethylene glycol or Miralax. This is an osmotic laxative, and so it actually pulls water into the intestinal tract to help with lubrication and also to help move the stool along. There is a product that you should not use as a laxative if you're taking a narcotic pain reliever. It's great to use if you're not taking a narcotic pain reliever, but you shouldn't use it if you're taking a narcotic pain reliever, and that is a fiber laxative. So something like psyllium or Metamucil. And the reason why is because the fiber laxatives add bulk to the stool, and that also helps to pull water in. And it will, having the bulk there is meant to increase intestinal movement to help you to have a bowel movement. But if you're taking a narcotic and the narcotic has slowed down the ability of the intestinal tract to move itself along, then if you take a bulk former, you can actually cause intestinal blockage. So this is not the right medication that you want to take. So Metamucil, on the other hand, great fiber laxative if you're pregnant, if you're someone who has low fiber in their diet. You do have to take it with an adequate amount of water. So you have to make sure that you're not someone who's fluid restricted. So someone who, let's say, who's fluid restrictive because of congestive heart failure or because of kidney dysfunction. The last thing I'm going to talk about, if there's time, Sarah, I don't know if there's time. I had one more.
Go ahead.
Time? All right. The last thing I'm going to talk about is the difference between Tylenol, which is basically called acetaminophen, and ibuprofen, which also has brand names like Advil or Motrin. Both of these are pain relievers. They can both lower fever, but only the ibuprofen can reduce inflammation. So ibuprofen is advantageous when there's inflammation present. Sometimes after you have an injury and you have a lot of inflammation, your doctor may prescribe you 800 milligrams of Motrin or something like that, which is ibuprofen. Important. Ibuprofen is also a direct stomach irritant, so it has to be taken with food. Ibuprofen also has antiplatelet effects like aspirin, which can increase bleeding risk. So if you're a person who is taking medications like warfarin or apixaban, you're really not meant to be taking ibuprofen at the same time. So that's something where you'd need to share that information with your doctor, or if you're going and buying it yourself over the counter, you'd want to know that so that you don't buy ibuprofen for your pain if you're someone who's taking a blood thinner already. And finally, Tylenol really is the pain reliever of choice for general pain and also for baseline post-surgical pain. The maximum amount of Tylenol that should be taken is 4 grams a day. Some healthcare providers don't want you to exceed 3 grams a day. And for patients who have liver cirrhosis or patients who have liver disorders, the maximum amount is 2 grams a day. You do not want to take Tylenol with other pain relievers that have Tylenol in it. So something like Vicodin is a combination of an opiate, hydrocodone, along with Tylenol. So if you're taking something like that, you might actually overdose on Tylenol and go over 4 grams a day if you're using Tylenol in combination with another pain reliever that's a combination product. So, and that could obviously lead to significant side effects. So those are my key tips. I hope they're helpful from a pharmacist standpoint.
Yeah, that's super helpful. I'm so glad that you've shared so much wisdom today with us on this episode, not just in what I've asked, but in the open mic, you've really shared a whole range of things. And I'm really grateful that people can hear from you and hear your wisdom. It's great to get your voice heard. So I've got to conclude our episode now. But firstly, if our listeners do want to find out some more about you and your work, where can they go?
Well, I would say that going to the UCSF homepage for the faculty in the School of Pharmacy has my bio there. And so you can learn more about me and the types of things, the type of research I've been involved with.
Absolutely.
That's the best way.
Great. Well, I'll make sure that is also linked in the show notes with those other resources that you shared so that our listeners can find it easily. So thank you again for joining us today, and thank you for your time and for sharing your wisdom. I've really enjoyed interviewing you.
Oh, thanks, Sarah. I really have enjoyed the podcast, and thank you for the opportunity to be on the show. I wish all listeners good health. I wish you optimism. I really hope that you've learned something valuable about supplements today and something that you can use yourself and maybe also share with another person. Again, that idea of sharing of knowledge that's at least evidence-based is something that's helpful. So yeah, thank you.
Absolutely. Well, thank you. Thank you for sharing so much wisdom. I'm sure our listeners have learned a lot. I hope that our audience has learned just as much as I have. Thank you so much for tuning into this episode, and we'll see you in the next one.
You have been listening to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website at longevity.lifemanagementsciencelabs.com, where you can join our movement. I'm Marie Stella. Thanks for tuning in.